Disc herniations in the neck can be very painful, but they can also be relieved completely naturally without surgery nearly all the time. There's so many treatment options out there that are non-surgical to help disc herniations in the neck, but some can actually make the neck pain worse and even worsen the disc herniation, which might lead to more invasive procedures, surgical procedures done unnecessarily. In this video, I'm going to share with you 11 worst treatments that you can do to get neck pain relief for your neck herniated disc. The first one is twisting all the way. This is often an exercise or a stretch recommended by healthcare professionals, and they'll tell you to twist or turn your neck all the way as far as you can and then go the other way. And the reason why this is bad is because the way the discs are designed in the bones of the neck, whenever you have a herniated disc, that's a sign that that disc is no longer as strong as it's supposed to be. It's injured. The herniation, that means that part of the disc has bulged outwards and it's no longer connecting the two bones properly. So if you force twisting all the way, then that causes your neck to overstretch and it can potentially worsen the disc herniation. The next one is forced chin retractions. Now, this is an exercise I commonly see physical therapists and chiropractors and other healthcare professionals recommend to their patients. And this is where a chin retraction motion is just where you shove your chin back, you move it back or retract it. It's like making a double chin. Now, the problem, it's a good exercise, it's a good concept, but forcing the motion, healthcare professionals will say, make your hand like this and put your fingers on your chin and push it back forcefully to get the bones and everything to move backwards. And the intent here is to create better posture in the neck bones, to align everything better. The problem is if you have that injured disc, it's going to potentially shear the bones on each other, which is going to make the disc worse as well. I've seen many patients over the years that really do a lot of this exercise and end up making their neck pain worse. And it's so confusing because there's research behind this motion, but the way that it's done is what the problem is. Number 3 is related to this one. It's repeated chin retractions. So when you do repetitions, when you're doing this over and over and over again, I always think that people look like birds walking whenever they do this because birds move their head forward and back like that. But I've seen patients come in for neck problems like disc herniations, and they'll say, yeah, I went to this place, they told me to do this repeatedly, and so I've just been doing this every, so many times a day. I'll do dozens of reps, hundreds of reps, but my neck keeps getting worse for some reason. It doesn't seem to be working, and the reason is because of that shear force as well. So you don't want to force it, and you don't want to repetitively stress it because that injures the disc in your neck even more. Number 4 is stretching neck muscles. The most common stretch that I see people do is they'll pull their head over and make it go as far as possible. They might turn their head and pull it this way, and the intent is to stretch the muscles in this area of the neck. And the problem with that is that those muscles tend to be overstretched already, and this isn't something that's commonly talked about or even identified by healthcare professionals, but in people that have disc herniations in their neck, usually their upper trap muscles, all their neck muscles are being elongated and overstretched because their shoulder muscles aren't very strong, so everything sinks down and it feels tight as a result of that. So stretching it kind of makes sense if you just look at it superficially, but when you look at it more deeply, if you understand how everything works, strengthening those overstretched muscles actually fixes the problem. This is how we fix the root problem of disc herniations in the neck. So stretching actually makes the muscles even weaker and feeds into the muscle imbalance. So you don't want to be overstretching. I tell people if you absolutely need to stretch, do it for just a tiny bit of time and don't get very intense at all. But if you hang out there and aggressively stretch your neck muscles, you're actually going to make the problem worse. Number 5 is weighted neck and head exercises. I haven't seen this in a while, but I have seen clinics out there that will put straps on people's heads and dangle weights from them, or there's big machines, big contraptions where there's a headpiece like a crown that you slide your head into, and then you hold on with your arms and you're moving your head against resistance forward and back and sideways, and you turn and you strengthen your neck muscles this way. But this is flawed because the muscles that turn and control the neck are not usually the problem. It's usually the shoulder muscles, the ones that make you shrug, that are the weakest muscles and causing those neck muscles that turn and control your neck to actually become over dominant. So if you're strengthening the neck muscles that turn you and move you around by hanging these weights on your head and moving against resistance, you're actually making the muscles that are too strong even stronger, which adds more compression to the discs in your neck. We actually have to look at other muscles around those, usually the shrugging muscles, in order to offload those neck muscles and take pressure off the discs to allow it to heal for the long term naturally without surgery. Number 6 is shoulder retractions. This is a super common exercise done in clinics, and it's where they tell people to do this. Pinch your shoulder blades back repeatedly. The problem with this is that when you pinch your shoulder blades back like that, you work out certain muscles that are between your shoulder blades called the rhomboids. These rhomboid muscles actually cause the shoulders to downward rotate more. They cause your shoulders to kind of sink down a bit more, which elongates these muscles up here and actually adds more compression to the neck bones and discs. And to make matters even worse, I often hear healthcare professionals tell their patients, don't only shrug backwards, but keep your shoulders low. They'll tell them to sink their shoulders down and then pinch backwards, which just adds to that elongation, that overstretching of the muscles in this area of the neck. The next one is aggressive traction. Now, traction is a good thing. This is where you might get put in a device that holds onto your head and pulls your head this way away from your body. Sometimes you're upright and they'll have a contraption, a pulley system that they hang weights on, and that adds a little bit of force, a little bit of lift on your head. There's other devices too where you lie down, and sometimes it's with a pump with a hand, or it's a big machine that an operator, somebody in the clinic, has to turn on and work and adjust, and it starts to pull your head away from your shoulders. And the theory is good in that it's taking pressure off the discs in your neck. The problem is if it's aggressive, there's something called the stretch reflex in your muscles. When your muscles start to get stretched because the traction is so aggressive, then your muscles respond without your control by trying to tighten up to resist the traction, the distraction, because it's dangerous for your muscles. If it's too much, your body protects itself by trying to contract, by trying to use the muscles to hold everything together, which makes the muscles stronger. When you use muscles, they get stronger, and this ends up adding strength to the wrong neck muscles, which adds compression over time. So this might feel good in the moment. You might feel like you got stretched out, but if your muscles were working against it the whole time, and usually it's a grimacing face that you'll make. It's like, oh, it's too much traction, but I'll take it. People will say that. I can take it, because they want to make sure they don't have surgery, so they're doing this traction and they're suffering through it in order to avoid surgery, but in reality they're making their muscles stronger because they're setting off that stretch reflex. That's not a good thing. You want to avoid aggressive traction. Now, light traction, I do that. I recommend that to patients, and if we're talking about pounds of force, you're talking about 5 to 10 pounds. The head on average weighs 13, 14 pounds, depending on your size. You don't want to take off more force than the full weight of the head. So going more than 13, 14 pounds tends to be too aggressive, and your muscles will feel it by trying to contract. Next, we have aggressive adjustments. And I'm talking about what chiropractors do, where they pop necks and they turn you, but there's also physical therapists that do this. I myself do this, but there's different ways to do adjustments. I call them manipulations, where you're moving the neck and you suddenly move it kind of quickly in an effort to free up a joint. Sometimes it creates a pop, sometimes not. In somebody who's got a herniated disc in their neck, it's important to not fully twist the neck, because that disc between the bones is injured and it doesn't have full connection. And if you over twist the neck, it can overstretch the disc and aggravate the disc and hurt it more over time, especially if these adjustments or manipulations are being done on a repeated basis, like multiple times a week for several weeks or several months. I've seen so many patients come into my office that have been receiving care like this for months, even years, and their neck pain has gotten worse. They usually tell me, it got better at the beginning because there was joints that were stuck that needed to be unstuck. But as they kept going through it, they got these treatments for too long, then their neck started to get looser and they started to feel worse afterwards. And if exercise is not paid attention to, if that root problem isn't addressed, while everything's getting looser in the neck, that's a serious problem that could be avoided if the treatment happens correctly. Next up, we have a reliance on medications. Some people, they take your over-the-counter pain medications, or maybe they even go to the doctor and get prescription strength pain medications that they're taking on a consistent basis in order to get relief from the neck pain that comes on from having a herniated disc in your neck. This neck pain can be so serious, it doesn't let people sleep at night, it ruins their concentration, it makes them want to just go lie down or get comfortable because they don't want to tolerate the rest of the day because the pain's so intense. And if you're in that situation and you're starting to take pain medications on a consistent basis, you might find that you feel better. It takes the edge off, maybe it doesn't go away completely, maybe it does, but either way, it helps. That's a good sign. That means that your neck pain has a chance to improve if the pain medication is helping it out. The problem is if you're not actively doing something to address the root muscle imbalance that's causing the disc herniation and you're only relying on the pain medications, then that problem, that root problem, is going to fester. It's going to get worse and worse as time goes on, because you might be thinking, well, I feel fine, and not do anything about the imbalance of muscles in your neck. And if a month goes by, months go by, then the problem gets worse. The stronger muscles get stronger. That adds more compression to the discs in your neck. The weaker muscles get weaker, and you're going to have to dig yourself out of a deeper hole if you start to address the root problem later on. Plus, not to mention all the side effects of medications. Of course, internal organ damage, your liver, your kidneys, your brain can be affected by this stuff too. Addiction problems if it's the prescription strength stuff. There's other issues that you don't want to face if you're taking either over-the-counter pain medications or prescription strength pain medications. They're not bad altogether. You might use them in a pinch to get through a short period of time. You just don't want to rely on them for weeks or months on end. Next up is relying on injections. Just like with pain medications, injections are pain medication that's injected into a disc or into a joint or into an area that's painful. They'll do this at a doctor's office. Very often a pain management doctor will do this for you. Even your general doctor will do this. And it could bring some longer relief than just taking pain medications by mouth. But the relief is still short term. You're not going to get long-term cure of the problem or improvement, decompression of the disc that lasts for a long time. It's just masking the pain that you're feeling, and it's not a good thing to be relying on. And the reason why I say relying is because some people will get into the habit where they go back to the doctor as soon as the relief wears off. And they'll go back every few months. Now your doctor will limit you to just 3 per year. They should be doing that because they know that the most common injected pain medication is cortisone. And there's other ones similar, other steroid, anti-inflammatory pain relief medications that they'll inject in. But we know in research, it's pretty clear that this medication breaks down connective tissue, which is what discs are made of, ligaments, cartilage, and other tissues in your neck. And so if you get too much of this medication injected into your neck, it actually breaks things down and can make the situation worse in the long run. So you're limited on how often you can use this. Now, I tell some patients who have never had an injection before and they're coming into my office, and if we can't make much progress on other fronts that we're looking at to work at and fix, I'll tell them, you know what, go ahead and go to the doctor, ask for a prescription, talk to them and see what they recommend first off. They may give you a pain medication prescription, or they may recommend an injection. Whatever you're open to doing, you discuss with the doctor and see what works best for you. But don't rely on it. You need to make sure that you're working on some exercise plan to fix the root problem while you're under the pain relief of the medication, because it may be that you can't exercise comfortably because of the pain. But if you get an injection or you're taking some pain medication, then you'll feel more comfortable and better able to tolerate doing the exercises to get you that long-term relief. So you're just taking the medications or doing the injection for a relatively short time, and you won't need it later on because you fixed the root problem. Now the last one here is surgery for a herniated disc in the neck. There's 3 surgeries commonly done. We have a fusion, which is where they put plates and screws in your neck and they connect the 2 bones. Then we have a microdiscectomy where they trim off the edge of the disc that's pinching a nerve. And then we also have a disc replacement where they cut off the ends of the bones of the vertebrae in your neck and they replace it with the disc. They usually go in on the front for that. Now this is extreme and it's also permanent. It may be what you need. There's some people out there that I definitely believe are good candidates candidates for surgery, but I also believe that surgery tends to be overdone for disc herniations in the neck because the root problem hasn't been addressed. And I also want to caution you, if you decide to go get surgery, if you've already had a neck surgery, you still need to fix the root problem, because if you haven't fixed the underlying root muscle imbalance, where certain muscles are too strong and others are too weak, and you're getting excessive compression through your neck, through your spine, then even with a fusion or the disc replacement or the discectomy, the surgery that you had, you're still going to aggravate the tissues in there, and you might cause the surgery to fail. Or what happens more commonly is the levels above and below, the discs that are above and below where you had the operation at, those become affected after some time. It's just a matter of time before you're talking to a doctor and they're telling you, well, maybe you need the next level fused above, or maybe you need another disc replaced below. And they're happy to do that, especially if it did buy you some relief. But if you got another disc herniation in your neck, that's a strong sign that you've got an imbalance there that needs to be addressed. That takes me to my last point here. This isn't a treatment that's worse. This is how you fix it. You've got to get stronger muscles, and it's usually the shrugging muscles, the muscles that help you shrug up your shoulders, and you've got to learn how to use them while holding your neck in the proper posture, the proper alignment, to use the deep neck flexors that are behind your throat right here. So you can't be shrugging and let your head jut out like that. You've got to shrug and maintain your head position. Now, I've got other videos where I talk about this, and you can learn more about all our information for neck disc herniations in the playlist we have linked in the description below here. Go check that out. If you thought this video was helpful, please give us a thumbs up. And if you don't want to miss out on any of our future videos, be sure to subscribe and turn on your notification bell. And please share this with a friend you think needs to hear this. Thank you so much. I'll see you in the next video. Bye-bye.